Hello, my name is Megan Stonehocker, and today I will be talking about cryptococcal meningitis. Meningitis is an infection and inflammation of the membranes, which are the meninges that surround the brain and the spinal cord. The meninges include the pia mater, arachnoid mater, and the dura mater. Meningitis can be caused by bacteria, viruses, parasites, or fungi. For my discussion today, I'll be focusing on fungal meningitis that is caused by Cryptococcus neoformans. Cryptococcus neoformans is the most frequent cause of fungal meningitis. So people can come into contact with Cryptococcus neoformans in the environment from anywhere in the world, but the incidence is higher in locations that are warm and humid. This type of climate provides more opportunity for fungal growth and propagation. And as you can see on the map, the incidence is especially high in sub-Saharan Africa, Southeast Asia, and specifically countries like India and China. 1 million people are affected by it every year. A cryptococcus infection is very rare for healthy people, but people who have HIV/AIDS are often afflicted by it, especially when someone's CD4 count is below 250. Approximately 6% of people who have AIDS acquire cryptococcal infections. The next biggest risk factor is if someone has some other type of immunosuppression, such as an organ transplant recipient. Having cancer, diabetes, or sarcoidosis also increase someone's chances for cryptococcus. People taking certain medications are also a risk factor. Some of those medications are steroids, such as prednisone. Also taking anti-tumor necrosis factor, which is given for treatment of rheumatoid arthritis or other autoimmune conditions, can increase someone's chances of acquiring cryptococcus. Cryptococcus neoformans is the main fungus, with Cryptococcus gatti also contributing to the cause of cryptococcal meningitis. These fungal spores come from soil, rotten wood, pigeon guano, and some other bird guano. It is transmitted through inhalation, travels into someone's lungs, and then it can become lodged into the alveoli. By adulthood, most people have breathed in Cryptococcus, but our white blood cells are usually able to fight it off and we remain asymptomatic. For those who become symptomatic, they may develop pulmonary cryptococcosis. From the lungs, it can travel to the central nervous system through hematogenous dissemination. However, Cryptococcus neoformans can have a latent infection where it lays dormant in your body without you even knowing it's there. And then if you become immunocompromised, such as getting cancer or liver disease later in life, then you could become symptomatic then. So the fungus can cross the blood-brain barrier, gaining access to the brain and cerebrospinal fluid. And here on the right is an illustration of the blood-brain barrier. The blood-brain barrier is a multicellular structure at the interface of circulation and the central nervous system. It is composed of brain microvascular endothelial cells, astrocytes, parasites, and neurons. The main function of the blood-brain barrier is to maintain that neural microenvironment by regulating the changes of the levels of molecules and protect the brain by blocking the entry of toxins and microorganisms that are circulating in the blood. The exact mechanism is not fully understood, but it is believed that pathogens can cross the blood-brain barrier transcellularly, paracellularly, and through infected phagocytes, which is the Trojan horse mechanism. In the transcellular model here demonstrated in A, pathogens cross the barrier by direct endocytosis of brain microvascular endothelial cells without disruption of the intercellular tight junction. In the pericellular model in B, pathogens penetrate between barrier cells through loosened tight junctions. And then the interaction between Cryptococcus and the host immune system is very complex. The fungus can modulate the host immune system, and its capsule helps it evade phagocytosis. Additionally, Cryptococcus can survive and replicate within macrophages, enabling its dissemination to other organs, including the brain. So the Trojan horse mechanism shown in C, that involves phagocytic microbial penetration of the barrier cells and using transmigration within infected phagocytes. So the pathogen cells are released from macrophages after penetration. And then the infection triggers an inflammatory response. A Cryptococcus infection first enters a person's body through inhalation, like I previously mentioned, so the lungs are usually the first organ to be affected. From there, it can travel to the spinal cord, the brain, and specifically the meninges, and this causes it causes an increase in pressure inside the skull and can destroy one or several parts of the brain. Some other areas that can be affected are the skin, prostate, peritoneum, and the eyes. However, cryptococci can infect any organ of the human body. Here is a brain from a cadaver. You can see that the leptomeninges, which is the pia mater and the arachnoid mater collectively, these leptomeninges, especially at the superior aspect of the brain, are very thick and opaque. So here you can see that this person had cryptococcal meningoencephalitis. So before cryptococcal meningitis occurs, some people experience pulmonary cryptococcosis. And so they have symptoms of cough, shortness of breath, pleuritic chest pain, and they may develop cryptococcal pneumonia. And then initial symptoms of cryptococcal meningitis are fever, headache, malaise, nuchal rigidity or neck stiffness, nausea, vomiting, altered mental status or confusion, and photophobia, which is sensitivity to light. And then in severe cases, people can experience seizures, cranial nerve palsies, blindness, deafness, decreased consciousness, and then they can even experience cerebral herniation, cerebral ischemia, optic nerve infraction, unstable gait, raised intracranial pressure, which can result in hydrocephalus, and then other neurological deficits may also occur. If it becomes very severe, in addition to the meninges, the brain tissue can become involved, resulting in meningoencephalitis, which you could see in the brain from that last slide. So the gold standard for diagnosing a cryptococcal infection is to culture the organism. However, this is pretty timely and can take a week or longer for the culture to grow. To confirm a cryptococcal diagnosis, a doctor can also perform a lumbar puncture to obtain that cerebrospinal fluid and then have that tested. And it can be diagnosed with India ink stain of the cerebrospinal fluid, which can be seen in the photo on the right. And the key diagnostic feature are the presence of single yeast-like structures ranging from 5 to 10 micrometers in diameter. And then it also has that very distinct, thick mucopolysaccharide capsules, and you can also sometimes see teardrop budding. Right here, you can see on the right that it shows a very clear halo around the refractive wall of the yeast. Cerebrospinal fluid usually shows mild mononuclear leukocytosis, 50 to 500 cells per microliter, and usually much lower in HIV and AIDS patients. And then there's also antigen detection that can be used on cerebrospinal fluid or serum, and it is especially helpful to rapidly detect an early asymptomatic cryptococcal infection in HIV-infected patients. And then there's also antigen detection, and there's 3 options for that. You have the latex agglutination, enzyme immunoassay, and lateral flow assay. Imaging studies such as X-rays, CT scans, and MRIs can also be used to determine changes in the lungs and the brain. However, the CT of the brain is actually normal in 50% of patients with cryptococcal meningitis. The most common abnormal finding is hydrocephalus. An MRI is usually a much better option to demonstrate abnormalities, and blood tests can also be used to help diagnose cryptococcal meningitis. So treatment options have been pretty well established. Amphotericin B and fluctosine is the preferred option for initial treatment, usually for 2 to 4 weeks. And in some cases, both of these medicines can be prescribed for a lifetime. This is because sometimes you can't trust that someone has ever gotten rid of the infection sufficiently. Fluctosine can be taken orally, but it needs to be taken every 6 hours for at least 2 weeks and until clinical improvement has occurred. If there were an option for it to need to be taken only once or twice a day, then compliance and outcomes would probably improve. Antifungal therapy with fluconazole is the recommended treatment for asymptomatic or mild to moderate pulmonary infections, and it is normally continued after initial treatment of cryptococcal meningitis for sometimes as short as 8 weeks or for an extended period of 1 or more years. Therapeutic lumbar puncture or ventriculoperitoneal shunts may be required to relieve pressure on the brain. You can see what a VP shunt would look like on the illustration on the right. Surgery may also also need to be done to remove large masses of fungus. Prognosis greatly depends on the patient's overall health, degree of immune suppression, the timeliness of treatment, and their access to medical care. If not treated promptly, the infection can be life-threatening. It can lead to cryptococcal meningoencephalitis, which I mentioned earlier, and that's the infection that involves the brain tissue. Following tuberculosis, cryptococcal meningitis is the second leading cause of death in people living with HIV. Cryptococcus neoformans is the leading cause of fungal meningitis that is responsible for 15% of AIDS-related deaths worldwide. Annually, there are 180,000 deaths due to cryptococcal meningitis. Mortality is estimated to be 20% in North America, but in some parts of Africa, it's estimated to be 70%. This obviously is a terrible difference and needs to be addressed. I believe that medical care and treatments need to be more accessible and more affordable for people all over the world. However, I have hope that future research will help to prevent and treat cryptococcal meningitis. There is current research being done on the impact of carbon metabolism on the yeast communication with the immune system, which will hopefully help identify critical areas that can be exploited for novel therapies and to prevent the movement of cryptococcus to the brain. Here are my references, and thank you so much for taking the time to watch my presentation.